Thank you for joining us today. We are coming to you from our strategic national stockpile. Wanted to give everybody an update of what we've been doing to order, distribute PPE to protect our healthcare workers, our first responders around the state of Oklahoma. But before we talk about PPE, I have the difficult news to deliver. In the last 24 hours, we have lost 16 Oklahomans to COVID-19. And as a father, a brother, a son, this is devastating news. My heart breaks for their families. 13 of the 16 deaths were 65 or older, but we all have to take this very, very seriously. Stay home if you can. Limit your trips to essential businesses and only send one person out to do your grocery shopping when possible. I know you still need to go to the grocery store or for the pharmacy. I'm just asking you to close your network, limit your exposure to new people or new environments. The fastest way to get us all back to normal is to limit those exposures. I also want Oklahomans to know that we have tested over 13,000 Oklahomans for COVID-19, and between 10 and 11% are positive. That means nearly 90% of our tests have come back negative. We need to continue to take this virus very seriously, but I want to make sure Oklahomans have an accurate picture of the situation in our state. There's a lot of bad information out there from the national media, from various websites, and I want to especially thank our local partners in the media, the Tulsa World, the Oklahoman, the Frontier, for verifying information instead of just sharing articles or charts based off inaccurate testing facts. We have more than 60 mobile testing sites all across the state. And I want all of Oklahomans to hear me on this. If you are showing symptoms, if you've got a cough, shortness of breath, or a temperature of 100.4 or more, we want you to get tested. If you've had exposure to someone that's tested positive for COVID-19, we want you to get tested. We have plenty of tests in the state. You can call 211, or you can go to coronavirus.health.ok.gov. We have 1,472 positive cases in the state of Oklahoma. 522 of those have recovered. That means it's been 2 weeks since they started showing symptoms and they're not in the hospital. Yesterday afternoon, we had 407 patients in hospitals across Oklahoma with COVID or COVID-like symptoms. Last Monday, we had 560. I am cautiously optimistic that our hospitalizations are starting to flatten. We are seeing proof here in Oklahoma and across the country that our social distancing is working. We have 5,600 hospital beds in Oklahoma, 958 ICU beds, and almost 2,000 ventilators in the state of Oklahoma. With 407 current COVID patients in our hospitals, we are in good shape. But I want you to know that we are still preparing for a surge on our hospital capacity. Secretary Schramm and Secretary Lockridge have been doing a great job and have been working around the clock with our hospitals on a comprehensive plan that they will brief me on later on today. I know how badly many of us want to get our lives back to normal, but what we do together over the next 3 weeks will significantly impact what we can do after April 30th. Gino DeMarco, who's up here with me today, is our PPE czar on the Governor's Solution Task Force. He's here and he's been searching around the world for the best ways to add PPE to our stockpile. We have PPE supplies on hand for our healthcare workers and first responders, and there's a system in place to replenish what they need. The CDC has also issued guidance to healthcare workers about how to conserve PPE and use it safely during this global supply crunch. Dr. David Chansholm, head of infectious disease at Integris, is here to share what Integris is doing, and I'd like to invite him up to share a few words about the best practices for our healthcare workers to maximize the effectiveness of our PPE supply. So, Dr. Chansholm.
Thank you, Governor Stitt, and thank you to the COVID task force in Oklahoma for all the hard work you're doing trying to keep Oklahomans safe. I was asked to say a few words about what Integris has done to try and maximize our personal protective equipment for our healthcare workers. I can say what we have done has been mirrored quite a bit around the metro, as I've been in regular communications with the infection preventionists at the major systems around Oklahoma City. What we've been trying to do, we've been looking at this for several weeks. We have been continuously updating strategies based on CDC guidance primarily, but also learning from some of the hospitals around the country that were first hit with the COVID epidemic, particularly in Seattle and in Boston. They've been very effective in sharing their data and sharing their strategies. The Nebraska Biocontainment Unit, which was originally set up for Ebola, has also been able to share a bunch of strategies. And what we focused on is maximizing the amount of PPE that we have, trying to make it useful as long as it can possibly be useful, and make sure that all of our healthcare workers have what they need to do their job safely. About half the time our team spends trying to figure out what we can do to keep Oklahomans safe, to care for Oklahomans who come to our healthcare facilities sick, and about the other half the time we figure out how we can keep our healthcare workers safe. So we continue to drill down on ways to make personal protective equipment last longer, to be more effective, to be more efficient with it, to get more of it, and we are excited that Governor Stitt and his team, along with Gino DeMarco, are continuing to help us try and get more of it in. We've had fantastic response from the community in helping us make some of it, and face shields in particular are something that we have gotten a lot of, lots of cloth masks from volunteer organizations, and it's that kind of spirit from the people of Oklahoma that are going to help us to continue to be successful at Integris and at other health facilities across the state. So thank you, Governor, for everything.
Thank you, Doctor. You know, my message to healthcare workers across the state, doctors, nurses, first responders, is this. Make sure you're familiar with the CDC guidelines on how to use PPE effectively. That is important to maximize our supply. At the same time, if you are short on PPE or your hospital is asking you to preserve beyond the CDC guidelines, I need to hear about it. One of my number one goals is to protect our healthcare workers. I also want to give an update on our unemployment claims. I know this is a very stressful time for a lot of Oklahomans. We've had a lot of Oklahomans who have lost their jobs. This is an unprecedented crisis across our country, and we have been having tens of thousands of calls per day to our unemployment department. I'm committed to making sure the state has the resources to support our hardworking Oklahomans, those who have lost their jobs, those who are working from home, and those who are on the front lines as essential businesses. A few months ago, we recognized the need to modernize the Oklahoma Employment Security Commission. We brought in Robin Robertson as the new executive director, and she is making great strides to revolutionize that department. I've asked her to come share a little bit more about what she's doing with that unemployment department. Robin?
Thank you, Governor, and good afternoon. On behalf of the entire team at Oklahoma Employment Security Commission, I'd like to ensure all Oklahomans that our staff is diligently working to administer these benefits as rapidly as possible during this crisis. We've been experiencing, as Governor Stitt mentioned, unprecedented and historic job loss, and as we continue, I'd like to share a high-level overview of where we are currently. So keep in mind, 4 weeks ago, our staff was processing our traditional and average 1,500 to 2,000 unemployment claims per week. Since that time, we're at unofficially a number of 135,000 claims. So obviously we have experienced an influx each day, and that has put a lot of stress on our team and also all of our technology. So what we're doing to change that and what we have done, I do want to mention quickly, our governor was one of the first in the entire nation to waive the first week waiting period, so thank you for that. Our agency, OESC, waived the work search criteria for regular unemployment claim periods, so people don't have to go out and perform that required work search that typically you see along with your claim. We also waived the benefit wage charges for all Oklahoma employers through the end of this year, December 31st, 2020. So that should help all of our employers with that tax charge next year. We'll talk a little bit more about the CARES Act. I'm sure there's some questions about that. We have not received all of the guidance for all provisions of the CARES Act yet from the Department of Labor, but we're involved in many of those conversations this week and have received guidance on several of the provisions and are starting to implement those as we speak. We have an all call to all retirees. We've added multiple persons, not just from our retiree pool with those with native unemployment insurance experience, but also multiple agency volunteers. In fact, over 130 from other state agencies. So I appreciate the efforts there, including the Department of Transportation, State Auditor's Office, and they've all received a crash course in training and are actually part of our Tier 1 call center support team now. Speaking of our call center support team, we've added over 100 agents in the last 2 days, and we will see that increase additional 200 persons to the end of the queue by this week, and are working with multiple call center providers to increase that even further. We've added an artificial intelligence chatbot to our homepage and have created a splash page, and it's powered by Google, so there are a lot of great ways a person can go there and find the path and the answers they need, so you may not need to actually call. All of this can be done online, and in fact, that's where you would need to file your claim. We've added a media and marketing team to help get the messaging out because it has been a very confusing process. I realize that this experience has been frustrating, confusing, and painful, and that's why we're making these changes. So we appreciate your patience at our agency. We have a town hall for our legislators this Thursday. Many people are sending in questions to their legislators. And we also have a public town hall for the entire state of Oklahoma that will be at 1 p.m. this Friday to answer your questions in real time in a much longer format. We also are rapidly implementing new user experience on our website, so hopefully you will see that. Right now when you look at it, it's clunky and confusing, a state website. So thank you, Governor Stitt. That's just a high-level overview. Appreciate your support.
Thank you, Robin. You know, Oklahoma, we are going to get through this. We have to stay strong and continue to work on our social distancing through the end of April. This is a critical time in our fight to slow the spread of COVID-19, protect our public health, and get our life back to normal as soon as we can. So stay home, stay safe, stay strong. God bless you. God bless the great state of Oklahoma. We'll open it up to a few questions.
We're going to take questions in the room and on Zoom, so we'll alternate. Go ahead, Eric.
Governor, we've heard that some of the personal protective equipment here is older. A lot of it started to deteriorate, some of the elastic, some of the plastic, some of the rubber. Is that the case?
I'm going to let our czar, Gino, answer that.
So I think there was some of that. It's segregated in the warehouse, but we have purchased literally millions of dollars worth of equipment from all over the world. It's coming in now a little bit at a time, but it's slowly and surely getting here. But we have plenty of personal equipment. As you can see in the warehouse behind us, we have plenty of stuff that's ready to go out as it's needed across the state. Gino, Gino, DeMarco, Demarco.
This question is from Barbara at the Tulsa World for Governor Stitt. Do you plan on signing all of the budget bills passed yesterday? And what was the specific problem that required canceling the Board of Equalization board meeting?
You know, I'm working with the House, the Senate right now on all those issues. We have a budget shortfall from last year, and we're in the middle of those discussions right now. My main focus is protect the health and lives and safety of Oklahomans through this COVID-19, and we'll be working with the House, the Senate, the rest of this week and also into next week to work on a good budget for next year.
With due respect, that doesn't really answer Barbara's question. What led you to cancel yesterday?
You know, we have about a $450 million shortfall from 2020, and it's my intent to protect core services, but we're just in the middle of negotiations about how much of the savings to use, et cetera, and we're in the middle of those negotiations with the House and the Senate, and so. The Board of Equalization could still meet later this week. We have to give 48-hour notice, but that's about all I can say right now about that.
Two questions. The first being, still though, I mean, I guess you haven't decided whether or not you'll sign all three of those bills right now, considering the legislature is no longer meeting for the rest of the week. And then secondarily, people I know have been asking us, there's PPE here. What's the process of getting that out, and how are you guys deciding when and where that goes? But the first question on those three bills, again, do you plan to sign those, or have you just not decided yet? Thank you.
Well, here's the deal. We have $450 million shortfall for the last 3 months of 2020. Oklahomans are struggling. Oklahomans are hurting. You just heard Robin report. We have about 130,000 unemployment. So asking the state government to also cut expenses by 1 or 2% is very reasonable in the current situation that we're in. So we're talking about agency cuts. We're talking about how do we protect agencies going forward. We're talking about how much of the money to spend out of savings. Thank goodness that we were fiscally conservative and we saved $200 million last year, and we have $1 billion in our savings account, because if we wouldn't have saved that $200 million, we'd be looking at $650 million in cuts. Or $650 million worth of a shortfall. So we have a $450 million shortfall for the last 3 months, April, May, and June. That doesn't even count what we're seeing for 2021, which is the budget process we're working on now. So there's a lot of things that we have to consider, and obviously we have the health department and all these different state agencies that are 100% focused on making sure that we take care of the Oklahomans and this COVID-19 crisis. But also, when Oklahomans are struggling, I'm going to protect the taxpayer, and asking state agencies to cut expenses by 1 or 2% seems very reasonable to me. And then I'll let Gino answer the PPE.
So I think the question was, how do we get the PPE out to the people that need it? There's a system in place that's been in place. It's our emergency management system is basically how that happens, the same way it would for tornadoes or anything else. They request it up through their county emergency manager. Those requests go to warehouses. We monitor every bit of that every day. We release to the warehouses to replenish their stock. And then if there are any emergencies that happen out there, which a few of those have happened, those requests are boiled directly up to us. We release the PPE out as requested.
Brent Skarkey, KFOR.
Governor, Brent from KFOR. Specifically, was the meeting canceled yesterday due to the digital transformation, I guess, omission that was made in that amendment that happened over the weekend?
Well, that was obviously, you read the bill, and so when there's just one agency that was singled out to be cut, that was part of our reasoning, and so we're back at the drawing board, and every option's on the table. But until we have that BOE meeting, you can't grab the $300 million out of the savings account. So there's $200 million available right now in savings to plug a $450 million shortfall for the last 3 months of the year. I'm going to continue to protect taxpayers. I'm not going to raise taxes. And when so many Oklahomans are struggling, we may have to take a 1 or 2% cut in our state agencies.
Paul Moniz from Oklahoma Watch says, Governor Stitt, is the state health department planning to release additional demographic details such as race, ethnicity, and city-level data on positive COVID-19 cases?
I don't think they're going to release, they'll release age, underlying health conditions, race. I don't think they're going to release race or anything like that, or the names. We'll redact all that information. But I'll check with with our director of health to see exactly what they can release.
Chris Castile, Oklahoman.
Hi, Governor. It's been about a week since you talked about modeling and the potential surge or the peak in the third week of April. I was wondering how the figures over the past week, confirmed cases, now that you're testing a lot more, hospitalizations, deaths, how they've tracked with your models and what you're looking at now in terms of where the peak might come.
You know, the IHME model that's produced by the White House is one of the models that we use in our ensemble. Has really flattened out, and it's lowered to around 1,300 hospitalizations at the peak. So that's encouraging. Some of our internal modeling is showing a peak that's moved out closer to mid-May to early May. We've got, when we talk about those modelers, we've talked about this before. It's like hurricane modeling. The more data, the closer that hurricane gets to shore, the more accurate it gets. The zone of uncertainty starts to narrow, and that's what we're experiencing right now. We obviously feed in our hospitalization. The death spike from the last 24 hours is obviously concerning. We had been clipping along at around 4 and 5, so that's going to go into the model. But basically, they're now pushed back to May is what we're showing, but they're considerably flattened because the actual numbers coming in ICU hospitalizations and deaths have not been what the early models expect. So in other words, we're not climbing that hockey stick right now, which is a great thing. And that's my message to Oklahomans is we have to take this seriously. We cannot get laxed in our social distancing. We've got to continue through April 30th, and then we'll be bringing more information, obviously, all the time. But Oklahomans are doing a good job, and we're just continue to pray that we're going to flatten this curve, and we're not going to see the spikes that they've seen in New York, Louisiana, Michigan. We're tracking more, if you look at those curves, more like Oregon, which is more of a flatter curve, which is really exciting.
Sorry, Governor, back on the PPE, you mentioned that if somebody has concerns that their employer, if they're a healthcare professional, is asking them to use PPE, reuse it beyond the CDC guidelines, you need to hear from them. Two things. What have you heard so far? What reports, what rumors have you heard about this so far? And then how do you want them to contact you to let you know about that? Thank you.
So we've heard. I mean, we've had friends in the healthcare profession, and we've heard about their lack of supply in certain hospitals. When I dig into it, number one, we have a report from hospitals across the state every single day showing us 8-day supply, 11-day supply. When they get critical, we're using this stockpile right behind me to ship to those hospitals and those first responders around the state. So this is why I had this press conference here. I wanted you to see all the work that we've done to make sure that we have an adequate supply across the state. So the answer is yes. If a nurse or a doctor or a first responder is being asked to use or reuse PPE that's outside the CDC guidelines, we need to know about it so we can contact that hospital and find out what's going on, because sometimes there's just communication issues, and that's why I'm here. So they can call my office. We'll set up an email that we'll get out to everybody where they can, we'll share that on television.
Hey, Governor. Two questions. First off, you said the revenue shortfall was going to be $450 million. Previously, you'd said it was going to be $416 million. Has it gone up? And then the second one, you mentioned that you're cautiously optimistic that the hospitalization rate is going down, yet we're seeing more Oklahomans die from this. So can you sort of, parse out the difference for me? Why would you think that hospitalizations would go down when more people are dying?
Sure. So the first question, $416 million is the revenue shortfall. When you think about the 1017 fund, it's also another $40 million. That's why we're kind of throwing that in together. I think the actual number is $459 million. Second question, what you're seeing today in the death rates are what's happened 2 weeks ago. So there's really a 2-week lag. I believe that our social distancing, our safer at home for our vulnerable population, our elderly population is working. We're not seeing as many people go into the hospitals. We've had a couple of outbreaks, unfortunately, in some nursing homes, and that's really added to our to our death rates, some of that vulnerable population, which we're taking mitigating efforts to stop that. But obviously, you got to have people getting into the hospital if you're going to be on this spike, like we're seeing in other states on death. So we've got 67 deaths in our state. That's 67 too many. We're doing everything we can to curb that. But it's a fact. It's a data point that I wanted Oklahomans to know, and it's something our modelers are looking at. It could be spiky. We could have 1,000 folks in the hospital tomorrow, so we're monitoring that. But it is a week-long trend here where we're seeing flat hospitalizations, and it's we're going to be data-driven in Oklahoma, and that's what I've told our team the whole time. We're going to be preparing for these surges, making sure that our hospitals are prepared. We've got the correct ventilators supply, and I'm just really proud of our team. We've got close to 2,000 ventilators in our state, and our peaks are right now in our models are showing we're going to need 500. So we feel like we're in a good spot. I'm not letting my foot off the gas. We're going to continue to prepare, and we'll be over-prepared. And that's my job as governor is make sure that we're prepared, and I'm looking out in the future on what might happen.
Can I get a follow-up? Okay, sorry, 2 follow-ups. First one, on the 1017 fund, would that be because of gaming revenue? And on the 2,000 ventilators, have you thought at all about some governors are shipping some of their PPE to states that need it most? And I realize that's a very tough decision as an executive to make, but have you thought at all about sending some of the excess supply to other states, maybe New York, whatever state is looking worst at the moment?
So it could be part of the gaming revenue in the 1017 fund. I'm not sure exactly how all the money flows into 1017. There's multiple sources that flow in there that are going to have a pro rata decrease, just like the regular general revenue fund. On the second part, we've had a couple of states. We know that we've seen a couple states ship some ventilators to other states. My number one job as governor is to protect Oklahoma, and so if we see we're flattening this curve and I'm beyond it, and I think Oklahomans are 100% safe, then we will release something to share somewhere else. But my job number one, as the governor of the state of Oklahoma, I'm going to protect Oklahoma first before I ship anything out to another state. And but we obviously are monitoring that. That's a question that's come up in my own mind is when do I feel like I'm past it? But I couldn't live with myself if we shipped something out and then we saw a spike and we needed ventilators in Oklahoma.
Matt Cabin, Medill Record.
Yes, Governor. Thank you for the time this afternoon. With the PPE, I know places like Marshall County have come down to like a 3-day supply in recent weeks. Our county is actually about 3 years older than the standard median age. How would you suggest our emergency managers and folks get that over to their folks, to paramedics sooner?
So I think that's the same resupply system we were talking about earlier. You can talk to your emergency management county manager and talk to him about that. We're monitoring everywhere, so we make deliveries every single day. And sometimes when things get tight, we would stretch things out. So if you're at 3 days, you have 3 days, and we can continually deliver you 1 or 2 or 3 days at a time to make sure that you don't go short. We're stretching what we have across the state, and as deliveries come in, we are shipping more and more stuff out.
God, jeez. Sorry.
Can we get that for you?
Sorry. Do you have stats on what you have in here and how much of what you have in here there is?
Back behind us?
Yes.
Yes, we do. Yes.
Can you tell us what those are?
Sure.
I can actually, kind of in round numbers, what you're looking at behind you is somewhere in the neighborhood of about 4 million pair of gloves, about 120,000 gowns. We've got about 173,000 face shields and goggles. There's about 900,000 surgical and medical masks. There's about 110,000 or so respirators. And then there's just a variety of other PPE that we're not really tracking specifically because we just don't feel like we're going to have a shortage of it. In addition to that, we've got probably in every one of those categories for between 1 and 5 times more of that on order that's coming in from just around the world. And on a day-by-day basis, you'll just see it build up and then go out as quickly as we can.
I just want to ask you one follow-up. When you say you think 1 or 2% cut might be reasonable right now, are you talking about the rest of this fiscal year or the FY21 budget?
We're talking about both. We have a $450 million shortfall in 2020, and then it looks like if the Board of Equalization met again and gave new projections for 2021 with the oil and gas revenue down, with obviously tax collections, sales collections down, 2021 is going to be off as well.
I have a couple questions. Since we now know, based on the health department's press release yesterday, that there was testing being done in February, why didn't we take action until a few weeks later? And then also, the CDC says 2 negative tests are needed to confirm recovery. And the Tulsa Health Department put out a statement on Facebook on March 12th saying the guidelines, saying the same thing, but now the guidelines are different. Why?
So the second one, I'm not sure about negative tests. If you have to test twice, I'll have to check that out, and I'll get back with you on it. And then the first part of your question was.
Question was, we now know that there was some testing being done in February, but why was there no action taken until a few weeks later?
Until March, yeah. You know, we were monitoring and we were looking at the modeling. And we were looking at what the CDC was recommending, and I think we had our first hospitalization in the state of Oklahoma on March 9th. And if you'll go back and look at our executive orders, we had 1 hospitalization, and we immediately acted and did our safer at home orders. We did our non-essential business orders. We suspended all elective surgeries. We then extended those through the end of April. And so we're taking the right action at the right time. And again, I remind Oklahomans, this is about personal responsibility. This is about you're safer at home. We know that with the social distancing. And Oklahomans are doing a good job. I mean, if you look at the businesses, they're letting their employees work from home. We've got state government working from home right now. So it's, I believe Oklahomans are doing a good job. We need to continue on this path to get more data, more testing in, and see where we're at. The February testing was negative, by the way. Yes,
real quick, Governor, you talked about 2,000 ventilators, and I did not go to medical school, unfortunately, for my paycheck. My understanding, though, is that sedatives and other drugs are required to operate ventilators. Can you or Mr. DeMarco or anybody talk about the medication that's actually necessary for those ventilators and whether there's other backup plans as well?
Sure.
Thank you.
Yeah, that's absolutely right. Being a ventilated patient isn't just as easy as being on a machine that helps you breathe. You got to have a lot of medications that are involved in that to sedate the patient, to make sure the patient's not experiencing a lot of discomfort. There's a number of medications that help break up the secretions in the lung, in the respiratory tree. And all of those things we continue to look at. I can tell you, as individual facilities, we continue to look at, and we have not seen a huge shortage yet on those things, although certainly distributors are shunting those to the places that are in highest need. Where we are seeing some other shortages are on medications that have been shown to maybe work in COVID. And then, of course, I can speak for Integris, but I know for other facilities also are also looking at medications that might be under investigation or on clinical trials to try and be part of the solution to this. Things like the antivirals and passive immunization with plasma and things like that. So those things are all being looked at constantly by our resource chains, and hopefully we won't come to the place where those are on shortage also. That being said, there's several different kinds of medication you can use, for example, to sedate somebody on a ventilator. So there's not just one, medication. There's just a couple different ones we can use.
Gino, could you speak to our backup plans on those two?
So yeah, on the ventilators, we've worked with some of the engineering partners that we have here in the state and looked at, under the new CDC guidelines, there's a variety of things that are allowed. The ICU ventilators are at the top, and then you can anesthesia ventilators all the way down to BiPAP and CPAP machines. So a couple of things. First is the engineers here in Oklahoma have looked at what the guidance is out there and figured out ways to modify the ventilators that we have and even the anesthesia ventilators to possibly serve longer. And then that goes all the way down to the BiPAP and CPAP machines. As soon as the CDC said those were available, to give you some idea of how Oklahoma has been competing in the supply chain, within 48 hours of being notified that those were available, we had 1,000 of them on the ground here in this warehouse. And so we're aggressively pursuing everything that we're allowed to do, and the innovation of some of the people here in the state from a manufacturing standpoint. We really do think that ventilators are an area where we are relatively well prepared for the curve should it come.
Stephen Metzer, Journal Record.
Hi, Governor. I was wondering if the legislature were to pass a bill including a 1% to 2% cut in agency spending across the board for this year, including for digital transformation, would you sign it? And also, if it would be possible for the legislature to do that without coming back to the Capitol.
You know, I'll look at every bill that's put before me that the legislature passes. Yes, the legislature would have to come back to pass a bill. We're just not going to single out one agency over another. We're all in this together. We're all family. I'm going to protect the taxpayer. Oklahomans are struggling, and state government has a $450 million shortfall. And so cutting expenses and tightening our belt on state government, I believe that's what Oklahomans want me to do. And we're going to continue to fight for that. And again, I'll continue to fight for the taxpayer and make sure that we do a great job. And again, thank goodness that we saved $200 million last year and have the largest savings account going into this economic downturn. So we have options to solve this, and I'm currently working with the leadership of the House, the Senate, have great relationship, great friends over there. We've got some smart people that are looking at this, and we will come up with a great solution for Oklahoma.
We have time for two more. Let's do Aaron and one on the phone.
Just two on digital transformation real quick. First of all, did Speaker McCall indicate, or anybody from the legislature indicate, why that wasn't included? And the second part of the question, the legislature gave you pretty broad powers yesterday. Can't you take some of the $50 million that they gave you to use to put that towards digital transformation?
I don't want to get into the specifics of he said, she said, and what goes on at the Capitol. We're in the middle of negotiations of the budget for not only 2020 but 2021, and in 9 months we'll be back up in here in January talking about the 2022 budget. So within 9 months we've got 3 issues that we've got to solve, and so just trying to think through that. I'm bringing everybody together to think through exactly what our revenue is, what our savings account is, where we can cut expenses. And we're right in this with Oklahoma. We're here to support Oklahoma, and we will come up with a great solution for 2020.
Last question, Tiffany Alanis, Fox 23.
Hi, yes, Governor, thank you so much for taking our questions. A quick question for you. I wanted to clarify quickly. I heard you mention that the death counts are a few weeks behind, but I believe that we had a death from over the weekend that was reported to us. So I just want to find out about that. But then I also want to ask you about the testing, because we are continuing to hear this. So I just want to find out from you what you are advising for people to do. So you mentioned that most of our deaths in the 16 more were from 65 and older, but we had a Tulsa County case of a 22-year-old named Israel Sows. I don't know if you've heard about his case, but it's a very heartbreaking case. He had tried to get tested several times and was not able to get tested over a number of weeks. When he was finally able to get tested and admitted to the hospital, he was immediately put on a ventilator and died a week later, and he died Sunday. We have heard, since we shared his story last night, we have heard from many other people who still are telling us that they cannot get tested. These are people that are sick. These are people that, never mind the people that have just been exposed to people with coronavirus. These are people that are sick right now. What should we be telling them? We've shared the information about the drive-thrus. We've told them all of those things. We've shared everything about the drive-thrus and all of that. What is your message to people who are still saying they cannot get tested while you're telling us that there are plenty of tests for everyone?
Yeah, first off, my heart breaks for that 22-year-old person there in Tulsa. and I heard the same thing, that that he had gone into the hospital and couldn't get tested. We've got testing sites set up across the state, our health departments all across the state. Anybody that's listening to me can call 211 and they will direct you to a place where you can get tested. Coronavirus.health.ok.gov. You can go there and find out where the testing sites are. What specifically happened and what hospital he went to and why they didn't test him, it just breaks my heart. We have the testing available in Oklahoma. I want Oklahomans to get tested. We have sent out messages to all of the health departments, all the hospitals. I was on a call with the hospitals yesterday. We are communicating with them 3 times a week. All of the hospital associations, the nursing associations. We're doing media meetings like this, press conferences, at least 2 or 3 times a week, trying to get the message out there. So we do have the testing. If you do have symptoms, if you have a fever of 100.4, cough, shortness of breath, or you've been exposed to someone who is tested positive, we want you to get tested. So call 211, go to that website. You can find out, contact your health provider. If they're telling you there's not, try something else, because we want you to get tested. We do not want to lose anybody else.
Thank you, everybody.